A lot of patients with a cervical herniated disc ask me what's the best stretching exercises to do. I'm not sure that stretching actually helps. Sometimes I've actually seen it hurt patients. So I went to speak to Andrea Wolkenberg, who is a physical therapist and does quite a bit of stretching, about her impression of how stretching can be used as treatment for a cervical herniated disc.
What we're trying to do always is we're trying to get the patient into normal alignment to unload the vertebral segments, to unload the discs.
Right.
Okay. So if you have muscle imbalance where you have your short, tight muscles, let's say in the front, and overstretched muscles in the back, or vice versa, depending on what your particular posture is, you need to stretch the short, tight muscles, and you need to strengthen the overstretched, weak muscs.
So is the answer to the question, yes, stretching is good for, or can be used for cervical herniated disc?
It can be used for cervical herniated disc,
right.
But it has to be used appropriately.
Right.
You have to target the tissue, and you have to make sure that in the course of stretching whatever muscle, you're not increasing the pain, and we're always looking to centralize the pain. So if anything we do, the person says, "Ooh, you know, I'm feeling that down my arm," that's a sign that you don't want to be doing that particular movement. We always, when we do our treatment, we want to have that pain recede back towards the center. That's
right.
our goal.
So the bottom line with stretching is that I think you have to be very careful. A herniated disc is putting pressure on a nerve, and that's creating symptoms down the arm. And a lot of stretching and pulling could actually aggravate this. So you can try stretching, but be aware that if your symptoms are getting worse, you have to stop. I think that stretching to mobilize your neck and get yourself moving a little bit more is fine, but should you have any increased pains, numbness, tingling, or weakness, it's not for you and you should stop. Stretching is okay. I wouldn't put it at the top of the list. I would be very cautious in using stretching as a treatment for cervical herniated disc.